Hello, everyone, and happy Wednesday. This is Nurse Eunice with Florida Training Academy, and today we're going to be discussing the CNA clinical skills. That's right, we have a practice test just for you, designed not only to help you pass your CNA examination, but to help you be better certified nursing assistants. So, as we do in all of our videos, we'll give you a few seconds to receive your notifications, and we will get started shortly. And hello, everybody. I see, oh my God, so many of you all. Rod, Tanae, Sarah, Delicious, Mila, Naomi. Looks like we have Josephine, Tanae. So good afternoon, good afternoon, good afternoon. We'll get started right now. And so, if you are unaware, Florida Training Academy has free CNA clinical skills videos. So, that is right. In addition to all of the practice tests that we have created, I mean, we have thousands of questions. So, there is no reason for you to fail the CNA examination. But in addition to our practice questions, we also have free CNA clinical skills videos available on our YouTube channel. And I know we have a lot of information on our YouTube channel. So if you're unable to find it, at youtube.com/Florida training. Go to our main website, which is fltraining.com, click on resources, and you should see one that says clinical skills videos. And that will take you directly to the link for the clinical skills videos so that you can see the skills that may be required during your nursing assistant examination. All right, team, let's get started with question number one. So, question number one, what is the first step a CNA should take before starting any patient care task? A, gather all the necessary supplies. B, make sure the bed is locked. C, wash your hands. Or D, check the patient's ID band. And hello, Anthea, Danu. Let's see. Valerie, Danita, so many great people. Amy. All right, so we'll reveal the answers in three, two, and everybody got it right. It is C. Wash your hands, and the crowd goes wild, or at least Nurse Eunice does. So C is the correct response. Hand hygiene is the first step to prevent the spread of infection. Question number two. When transferring a patient from bed to wheelchair, which step ensures patient safety? A, lock the first two wheels of the bed. B, lower the bed as much as possible. C, position the wheelchair as far away from the bed as possible. Or D, lock the wheelchair brakes. Oh, I know you all are too smart to get this one wrong. So I will reveal the answer in three, two, and ding, ding, ding. If you chose D, I see you, Karen, Azor, Mila, Chrissy, Tanae, and Kim. If you chose D, you understand that locking those brakes, especially when it comes down to the wheelchair, is a priority. So locking the brakes prevents the wheelchair from moving, therefore reducing the risk of falls. Question three. What is the correct way to to provide oral care to a conscious patient? So this is a person who is responding to you. Do you A, lay the patient flat in bed? B, sit the patient upright in a chair or bed? C, tilt the patient's head backward? Or D, provide care while the patient is lying on their side? How do you provide oral care to someone who is conscious, someone who can follow commands? And I'll reveal the answer in five, four, three, two, and I am so proud of you. It is B, sit the patient upright in a chair or a bed. So sitting the patient upright prevents choking and aspiration during oral care. So that's going to be one of those upright positions known as high Fowlers, and that's when you have them 60 up to 90 degrees. So sit them up. All right, so question number four. Which of the following steps should be taken before ambulating a patient? A, check the patient's weight. B, ensure the patient is wearing socks. C, lower the head of the bed. D, ensure the patient is wearing non-slip footwear. All right, so you ready for your CNA test? You got to get your resident up. You have to walk them. That's another way of saying ambulation. And which of these would apply so that you can pass your clinical skills test? And when I tell you everybody got it right, I mean everybody. You are absolutely correct. It is D. You're going to ensure the patient has on non-slip footwear. So if you're in the hospital, it's the socks with the groupies. If you're not in the hospital, you're going to put them on their regular shoes. No one should get up in socks, and definitely no one should get up in trouser socks or their Ted hose, because as soon as they stand, they can start slipping and they might fall. Question 5. Oh, did I tell you we're going all the way to 50? So, yes, we're going to rock it today. Let's do this test. What is the proper technique for perineal care on a female patient? Is it A, wipe from back to front, B, wipe from front to back, C, wipe in circular motions, or D, wipe side to side? And if you do C or D, we're reporting you to your nurse, because if you do C or D, that is so inappropriate. And of course, A is inappropriate because you're putting, for lack of a better term, poop in the coot. So we don't want to do that. So your correct response should be yes, it is B. We're wiping from front to back. We're wiping from the cleanest area back toward the dirty area. So wiping from front to back prevents bacteria from the anal area from contaminating the urinary tract, but you all knew that. Question number 6. When assisting a patient with dressing who has one weak side, which side should you dress first? Is it A, the weak side, B, the strong side, C, both sides simultaneously, or D, it doesn't matter? So Miss Lucille has a broken arm on the right. Where do you start dressing her? Her right arm needs to be in a sling. It needs to be supported. Do you want to dress her first from the right side, dress her first from the left side, or try to both dress both her left and her right side simultaneously? All right, so we're revealing the answer right now. And if you chose A, you are right. Whenever someone has a weak side, you always dress the weak side first. So dressing the weak side first makes it easier to dress the patient without causing discomfort or injury. I hope you're enjoying this test, and you all know that I need to engage your audience. Let more people know about our free training resources. So if you made it this far, go ahead, make it official, hit that subscribe button and give us a thumbs up. And don't forget to share our free resources, our website, with your family, your friends, and also your coworkers. All right, so question number 7. What should you do if a patient starts to fall while you are assisting them to walk? A, try to catch the patient and hold them up. B, ease the patient to the floor. C, call for help immediately and leave the patient standing. Or D, move out of the way and let the patient fall. But one of those options is going to end up causing you to be on the news. So we are never going to do D. And so let's see what you all chose. Let's see. And when I tell you round of applause, all 57 of you chose B. We know if someone's falling, we don't want them to fall on us, but we have to get them to the floor. We have to ease them to the floor, because easing the patient to the floor reduces the risk of injury to both you and that patient. So get them on the floor. And of course, you are screaming and calling for help. And then we will do a team lift. The nurse, the rest of the hospital team will do a team lift, get them to the wheelchair, and then we will get them back into their room so we can assess them and try to find out the reason for their dizziness. Question 8. All right, Mrs. Love, child of God, you're going for your test next week. We are praying for you, so we know you'll do well. All right, question 8. When providing foot care to a diabetic patient, what is the most important precaution? A, soak the feet for at least 30 minutes. B, clip the toenails straight across. C, avoid soaking the feet for long periods. Or D, massage the feet vigorously. Marcia, topic with T, Tinette, Chrissy, Kelly, Darlene, Latanya, Kelly, so many of you all, Karen. Everybody get it right. It is C. Avoid soaking the feet for long periods of time. Look, we can't have their feet wet, especially soaking. The skin is going to get all eroded. So, diabetic patients are at a higher risk for skin infections and wounds. So, prolonged soaking can increase the risk of skin breakdown. And as a reminder, as a nursing assistant, you don't clip anything. That is not within your scope of practice. Look, you are not a cosmetologist. We can file, but we cannot clip. All right, question 9. What is the correct way to measure a patient's radial pulse? This is long. So do you count it for 15 seconds and multiply by 4, 30 seconds and multiply by 2, count it for 60 seconds, or count it for 20 seconds and multiply by 3? That was my summary. Now, we're talking about for the state exam. We're not talking about what you see in the real world. We're not talking about the fast way. We're talking about the way you're going to perform your skills when you are preparing to take your CNA examination. And so, if you chose See, you are right. Count the pulse for 60 seconds. So, counting the pulse for 60 seconds provides the most accurate reading, especially if the pulse is irregular. When I tell you I'm proud of you, so I hope you are proud of you as well, because almost 100% of you all have gotten every question correct. All right, so question number 10. When providing a bed bath to an incontinent patient, what part of the body should you wash first? Is it A, the legs, B, the genitals, C, the arms, or D, the face? This one's tricky. Let's see. All right, even my hard questions are too easy for you all because everyone got the right answer. No one chose the genitals, everyone chose the face. So the answer is D. The face is usually the cleanest part of the body and should be washed first to prevent the spread of bacteria to dirty areas. So we wipe from the cleanest and then we work our way down to the genitals. So even if the person's wet, start up top first and then work your way down. Question number 11. What is the best method for repositioning a bed-bound patient to prevent pressure ulcers? Do we want to A, reposition a patient every 8 hours, B, place pillows under their knees, C, reposition a patient every 2 hours, or D, keep the patient flat on their back at all times? Oh, I know this one is way too easy for you all. So we're going to go ahead and reveal the answer in 3, 2, and yes, it is C. All of you all are correct. We're going to reposition them every 2 hours because frequent repositioning reduces pressure on bony areas, helping to prevent pressure ulcers. So in reality, we reposition them every 2 hours and PRN because if we turned them an hour ago and they're already complaining of pain, we're not going to let them stay in that position for another hour. We're going to go ahead and reposition them again. Question 12. What is the correct way to apply a gait belt to a patient? A, secure the belt around the patient's chest. B, place the belt loosely around the patient's waist. C, place the belt snugly around the patient's waist. Or D, buckle the belt behind the patient's back. Don't do D. All right, everybody. Team, we're revealing the answer in 5 seconds. 4, 3, 2, and I see a lot of A's and I see a lot of C's. So you all, the gait belt does not go around the chest. It is C. The gait belt goes snugly around their waist. So the belt should be placed around the waist to provide proper support and stability. And don't forget that whenever you're placing a restraint, a gait belt, anything constricting on a patient, go ahead and insert those 2 fingers in there. If you can't get 2 fingers between the device and the patient's skin, that means that belt is too tight and they will not have enough room for circulation. Right, question number 13. When feeding a patient who has difficulty swallowing, what should you do? A, offer small bites and thickened liquids. B, give the patient thin liquids. C, lay the patient flat to make swallowing easier. Or D, provide large bites of food to encourage Faster eating. All right, Miss Eunice, I need you to eat this food fast so I can get my break too. Here you go. And just shove a whole bunch of food into your patient's mouth. Well, we know we're not going to do that. But if you chose A, you have it. So you're going to offer small bites and thickened liquids. The rationale: thickened liquids and small bites reduce the risk of choking and aspiration. Question 14. When performing catheter care, which direction should you clean? From the meatus outward, that would be A. B, from the bag upward. C, circular motion around the catheter site. Or D, from the insertion site towards the bladder. Whew, that was a lot to say. Let's see if you can get the correct response. The endured Naomi, Marcia, Mrs. Love, Child of God, Andres. It's so many of you all. I can't even keep up. And you all have it right. It is A, from the meatus, from that entry point outward. So cleaning from the meatus outward helps prevent introducing bacteria into the urinary tract. So when we're cleaning a catheter, we never want to wipe the germs into the patient. We hold the catheter and wipe away. That way, we're pushing the germs away towards the end of the catheter, going towards the actual drainage bag itself. Number 15, how often should you empty a catheter drainage bag? This one is tricky. Is it A, every 8 hours, B, every 12 hours, C, every shift, or D, as needed when it's half full? Amy, Tanae, Yolanda, Sarah, Latanya, you got it. It's not about the time because your nurse will be giving this patient diuretics, and the diuretic is going to pull off that excess fluid, and we usually give it twice a day. So if your nurse gave that diuretic at 8:30 a.m., by 10:30 a.m., that bag is probably already filled with urine. Do not wait until the end of your shift. You're supposed to empty that bag when it's half full. And then if you empty it when it's half full, and let's say it takes the rest of the day, your shift before it gets half full again, you'll also be emptying at the end of your shift. So to summarize, you empty your bag as needed when it's half full, and then at the end of your shift. That way, when the next shift comes on, they have a bag that is empty and they can calculate their output correctly. All right, question 16. What is the correct way to measure a patient's fluid intake? A, measure fluids in ounces. B, measure fluids in milliliters or cubic centimeters. C, record fluid intake in cups. Or D, estimate the fluid intake. All right, revealing the answer in three, two, and you all are so amazingly smart. You all know it is B. We're going to measure it in milliliters or cubic centimeters. So fluid intake should always be recorded in milliliters for accuracy. But in some of your facilities, you may hear us say a cc. In reality, a ml and a cc are equivalent to each other. So it just depends on what term your facility prefers that you use. Question 17. When removing soiled linens from a patient's bed, what is the proper technique? A, place the soiled linen on the floor. B, shake the linen out to remove debris. C, place the soiled linen on the floor until it can be disposed of. Or D, roll the soiled linen away from you. And I am so proud of you because you are smart CNAs and you chose D. You know you're going to roll the dirty stuff away from you. So, yes, it is D. Rolling the linen away prevents contact with contaminants and reduces the spread of infection. Question 18. When providing mouth care to an unconscious patient, what position should the patient be in? Is it A, supine, B, lateral or side lying, C, high Fowler's, or D, Trendelenburg? So your patient is unconscious and they don't have a gag reflex. What position should they be in when you're providing oral care? So many of you all. I see a lot of B's. I see a C. I see a D. I see an A. So here's the correct response, everybody. When someone cannot cough, when they do not have a gag reflex, you never want them upright. You never want them laying flat. You don't want them upside on their head. That is D. Trendelenburg. What you're going to do instead is turn them to their side. It is going to be a lateral sideline position because placing the patient on their side helps prevent aspiration during oral care because the excess fluids don't go to the back of the throat. They accumulate in the cheek area, and you're not putting a whole bunch of secretions in their mouth. You're going to take the oral swab, put a little bit of mouthwash on it, go in there and gently cleanse their teeth, gums, and their tongue. And then the fluids that have accumulated in their cheek area, if you have a suction device, you can go in there and suction it out. If you don't have a suction device, you would take a tongue depressor and maybe like a washcloth. Stick that tongue depressor in that washcloth and go ahead and remove that extra moisture that remains in their cheek area. All right, question 19. What is the proper way to assist a patient with ambulation who has a weak side? Do you want to do A, stand on the patient's weaker side, B, stand in front of the patient, C, stand behind the patient and provide support, or D, stand on the patient's stronger side? So Mrs. Lucas had a stroke and she has right-sided hemiparesis or right-sided weakness. When you are walking her, what side do you want to assist her on? Revealing the answer in three, two, and yes, everybody, it is A. You're going to stand on a patient's weaker side because standing on the weaker side provides better support and balance during ambulation. So the cane is on their strong side and you're on their weak side. So that way they have support on both sides of their body. Right. So, what should you do before applying anti-embolism stockings or the TED holes, those really tight holes that are hard to put on? Do you want to A, soak the patient's leg in warm water, B, apply powder to the legs first, C, measure the patient's legs for proper fit, or D, ensure the patient is standing before applying the stockings? Oh, I see you are slower with these answers. Yep, this one wasn't familiar to you because you probably haven't placed any TED holds on any patients. And so I'm revealing the correct answer in three, two, and we are torn between A's, C's, and D's. The correct response is going to be C. Look, you need to measure them because Mr. Lucas is 100 pounds but Mrs. Lucas is 300 pounds. So it's not one size fits all. If you put stockings that are too big on Mr. Lucas, they are not going to be effective. What's the purpose of putting these tight holes on someone's legs? Well, it is to force the blood to move. Whenever they move their legs, the blood isn't going to be pulled in their legs. So if the socks are too large, the stockings are too large, they're not going to be effective. And if they're too tight, they're going to cut off circulation. So, properly fitting stockings ensure they work effectively to prevent blood clots because they're helping to move that blood and prevent it from pooling in the legs when the person stands up. Question 21. When providing a bedpan to a patient, what is the first step after washing your hands? All right, so you just entered the room, they need the bedpan, you've washed your hands. Is it A, raise the head of the bed, B, lower the head of the bed, C, position the bedpan under the patient, or D, ask the patient to stand up? All right, revealing the answer. Oh, you're torn between A's and B's. A lot of A's and a lot of B's. So we reveal the answer in three, two, and all right. So let me just make sure because I don't like how this question was read. What's first step after washing your hands? All right. So I see why you all chose B and I see why you chose A. So I need to clarify. In order to put the person on the bedpan, you lower the head of the bed. Once they are on the bedpan, in order to make sure that they can alleviate, that they can get everything out of their bladder and bowels, you raise the head of the bed. So for this one, because it was my error, whether you chose A or B, I'm giving you the right answer because I didn't like that question. So my apologies. Please forgive Nurse Eunice. All right, question number 23. What is the correct method for cleaning dentures? A, scrub them with regular toothpaste. B, brush them with a denture brush brush them with a denture brush using denture cleaner. C, soak them in hot water with mouthwash. Or D, rinse them in cold water only. The correct method for cleaning dentures. And everyone has it right. Yes, it is B. Brush them with a denture brush using denture cleaner, such as the denture paste. So, denture cleaner is formulated to clean dentures without damaging them. And brushing with a denture brush ensures all surfaces are cleaned. And if you need freebies, study guides, if you want to purchase our flashcards, they're only $5. Go to fltraining.com, go to resources, or you can go to our store and you can see our plethora of resources. I really thank you for supporting the nurse-owned business and for all that you do for our patients and for our communities, because without CNAs, that's why I spend so much time training our CNAs. Without CNAs, we wouldn't have nurses. So if no one has thanked you today for all the hard work that you do, remember, a nurse and a CNA partner together, we help to save lives and we help to keep patients independent. All right, so question number 23. When providing nail care, which of the following should be avoided? Is it A, filing the nails, B, drying between the fingers, C, soaking the hands in warm water, or D, clipping nails too short? Which should be avoided? 100% of you all got it right because we know that clipping nails is not a CNA's duty. So the correct response is D. That's what you don't want to do. Cutting nails too short can lead to injuries or infections, especially for patients with poor circulation or diabetes. And then don't forget, your patients are also on blood thinners. Even aspirin's a blood thinner. So if you go in there and you clip their fingernails or their toenails, you could clip their skin and cause a bleeding injury. Question 24. When assisting a patient with a cane, which side should the patient hold the cane on? Is it A, the weaker side, B, the stronger side, C, alternate in between sides, or D, it doesn't matter? And I already gave you this answer, so we'll reveal the response in 3, 2, and 100% got it right. It is B, the stronger side. So the patient should hold the cane on their stronger side to provide support while stepping with the weaker leg. Question number 25. How should a CNA safely assist a patient with one sided weakness in transferring from a bed to a wheelchair? All right, so is it A, position a wheelchair on the patient's weaker side? B, position a wheelchair on their stronger side? C, have the patient stand up without assistance? Or D, let the patient transfer independently? You all are phenomenal. Yes. So if a person's had a stroke on one side, don't put the wheelchair towards the side that's affected by the stroke because they won't be able to move in that direction. It is going to be B. You're going to place the wheelchair on the stronger side because it makes it easier and safer for them to transfer. Question 26. What is the safest way to measure a patient's height when they cannot stand? So this patient has a debilitating illness. They can no longer stand. So what are you going to do? Are you going to do A, use a measuring tape while the patient is lying down? B, ask the patient to estimate their height? C, measure the patient while sitting in a chair? Or D, record the height from their last hospital admission? What do you think is safest for your patient? If we're trying to determine their BMI, we need their height and their weight. So, what should a good CNA do? And all of my good CNAs said, A. So, A, you're going to use a measuring tape. When a patient cannot stand, their height should be measured with a measuring tape while they are lying flat in bed. Question 27. Which of the following steps should a CNA take to prevent injury when lifting an object? Do you want to A, bend from the waist, B, keep your feet close together, C, lift with your legs, not your back, or D, hold the object far from your body? Yeah, this one's a little tricky, you all. As a CNA who wants to protect her back, one thing you never want to do, especially when you're trying to lift an object, you don't want to lift with your back. So you don't want to do A. The correct response is going to be C. Use those large leg muscles. You want to lift with your legs. So using the leg muscles instead of the back prevents injury when lifting heavy objects. Question 28. When providing passive range of motion exercises to a patient, which body part should you support? So, passive means that the person really can't move this joint. You are doing the exercises for them. Are you going to A, support the bones, B, the muscles, C, the neck, or D, the joints? Where do you support? You all, great job. You always support those joints. It is D. Supporting the joints during RM exercises helps prevent injury and ensures proper movement. Question 29. What should you do before feeding a patient who's in bed? Do you want to A, turn the resident on their side, B, feed the patient while they are lying flat, C, sit the patient upright in a high Fowler's position, or D, offer the patient a drink of water? And I know you probably want to choose D, but D is not mandatory. What's mandatory to prevent aspiration is C. You're going to put the patient upright in a high Fowler's position. Remember, that's 60 up to 90 degrees. High Fowler's position prevents aspiration and allows the patient to swallow more easily during the feeding. So the high Fowler's position will be the priority. And then before you start feeding them, you can give them a sip of water. Right? Question 30. When performing a bed bath, what should you do after washing the patient's face? A, dry the face and move to the neck. B, wash the patient's feet. C, apply lotion to the patient's face. Or D, move to the chest without drying. And this is going to be really important during your test because you have so much to remember. I would hate for you to do the skill correctly, but to miss one important step, such as A, drying the face before you go to the neck. So, drying the face before moving on to the other areas ensures comfort and prevents water from dripping onto the other parts of the body. Don't forget, when you wash a patient's face, we do not use soap. And whenever you're cleaning an eye, you clean from the inner cannula towards the outer part of the eye. And if you're cleaning two eyes, you make sure you change positions on the washcloth so you don't take the contaminants from the left eye and then put them in the right eye. That is how conjunctivitis or pink eye is often spread. Question 31. Which of the following is an appropriate action when assisting a patient to sit on the edge of the bed? We call that dangling. Is it A, ask the patient to swing their legs quickly over the side of the bed? B, have the patient dangle their feet while lying down? C, leave the patient unattended to build independence? Or three, slowly assist the patient to sit up and dangle for a few minutes? Right, we have to get Mrs. Millie into a wheelchair so she can go to her hair appointment. And the non-medical van is waiting for her. So we need to get her up into the wheelchair, but we have to do so safely. So we need to dangle her. What is going to be the correct response? And if you chose D, slowly assist the patient to sit up and dangle for a few minutes, you are correct because dangling allows the patient to adjust to a sitting position before standing and it reduces the risk of falls or dizziness. Question 32, and I hope you're enjoying this test. And if you haven't given us a thumbs up, I'm gonna keep asking for it until you give us a thumbs up. Go ahead and do so now. Question 32, how often should the CNA turn and reposition a patient who is bedridden? Well, if you don't know this one by now, I'm just going to go ahead and go right to the answer because it is obvious that it is C, every 2 hours. Question 33, what should you do if a patient refuses to eat? A, force the patient to eat. B, report the refusal to the nurse. C, leave the food and come back later. Or D, remove the food and don't offer it again. Garcia, Glolicia, Renata, Chrissy, Tanae, and Thea. Oh my God, so many of y'all. Berwin, Sarah, Karen, Valerie, Tamika, Mila, My Rich Yo says B, Uma. All right, so everybody, it is B. You want to report the refusal to the nurse. A CNA should report a patient's refusal to eat as it may indicate an underlying issue that requires medical attention. Anytime your patient eats less than 50% of their meal, go ahead and tell the nurse. What we don't want is for you to keep that secret all day. And now at dinner time, you're like, hey, Nurse Eunice, Mrs. Lucas didn't eat breakfast, lunch, or dinner. When I call the doctor to tell that, he or she is going to think that I'm a plum fool and that I am not supervising my CNA. So, what I want you to do is if a patient doesn't eat, don't just document in a computer, let your nurse know so we can work towards getting them a supplement earlier in the day or finding out the reason why they aren't eating as much as they should. Question 34. What is the proper way to measure urinary output? Is it A, measure it directly from the catheter bag? B, pour it into a graduate and read the measurement at eye level? C, estimate the amount of the size of the container? Or D, pour it into a measuring cup and record in ounces? So when I think of ounces, I think of something I drink, not something I let out. So we rarely ever record urine in ounces. So it is not D. And looks like everybody said B. Let's see if you are correct. And you were. So D, pour it into a graduate or a graduated container and read the measurement at eye level because urinary output should be measured in a graduated container at eye level for accuracy. So how you hold things up in the air with the liquid still moving in a graduated container, that's wrong. That's not going to pass you on your exam. Put a napkin down, sit the graduated container on top of that napkin, and bend down and read the amount of urine that's in your graduated container at eye level. So it's not that you hold it up in the air, you need to put it down on a surface such as a napkin and read it once the fluid has stopped moving. Question 35. How should a CNA safely assist a patient with transferring from a wheelchair to a toilet? Is it A, have the patient stand independently, B, position a wheelchair at a 90-degree angle to the toilet, C, lock the wheelchair brakes and assist the patient with a gait belt, or D, leave the wheelchair unlocked for easier movement? And I know when you're reading this, you're like, no one does that in the real world. They're just adding all these extra steps. And you're right. And that is how your CNA test is. Your CNA is not test is not based on the real world. It's based off of what is safest for that patient. And so if you chose C, if you took that extra step and put a gait belt on your patient in order to get them from the wheelchair to the toilet, you are a safe caregiver because locking the brakes and using a gait belt provides stability and reduces the risk of falls. Question 36. We're providing catheter care. How should you clean the catheter? Is it A, clean from the bag upward, B, clean from the insertion site outward, C, clean the tubing with an alcohol pad, or D, soak the catheter in warm water? And while you're answering that one, I'm going to take a quick water break. I think 99.9 of you got it right. It is B, clean from the insertion site outward. You want to wipe those germs away from the meatus. So cleaning from the insertion site outward reduces the risk of introducing bacteria into the urinary tract. Question 37. What is the primary reason for keeping a catheter bag below the level of the bladder? Is it A, to allow urine to flow by gravity and prevent backflow? B, to reduce the risk of the catheter falling out? C, to prevent discomfort for the patient? Or D, to prevent the bag from becoming too heavy? Why do we keep the bag below the level of the bladder? Why not just lift the urine bag, the pee bag, all the way up towards someone's head and hang it on the IV pump and walk them to the bathroom that way? All right, because that's nasty. But then number two is because A, if you have the bag higher than the bladder, you allow the urine to flow backwards, that old urine to go back into the bladder, and you're going to give them a UTI. So keeping the catheter bag below the bladder level ensures urine flows downward into the bag by gravity, reducing the risk of urine backflow into the bladder, which could lead to a urinary tract infection or worse, a bladder infection. Question 38. No problem, Mila. No need to apologize. Question 38. What is the best way to prevent a pressure ulcer in a patient who is immobile? Do we want to A, massage bony areas, B, avoid repositioning the patient to prevent discomfort, C, use lotion on all pressure points, or D, use pillows to keep bony areas off the bed? So proud of you all. 99% of you all chose D. So let me explain to you why it is not A. So the correct response is D. Use pillows to keep the bony areas off the bed because pillows reduce pressure on the bony areas, which helps to prevent pressure ulcers from forming. The reason why it's not A, massaging over bony areas, is because when you have somebody who's really frail, sometimes you can like literally see like their skeleton, you can see like their bone structure. And so if you start rubbing on top of that bony area, you're actually helping to increase inflammation, to increase the tissue damage in that area. So we do not advocate massaging bony areas in order to prevent a pressure sore. What we do advocate is repositioning and offloading with pillows, and also good hydration, good nutrition. And if someone wets themselves, you need to provide that perineal care quickly. Question 39. How should a CNA perform abdominal thrust, previously referred to as the Heimlich maneuver, on a conscious choking adult? Do you want to A, stand behind the patient and place your hands on their chest? B, deliver sharp blows to the back? C, stand behind the patient and perform upward thrust below the rib cage? Or D, ask the patient to lie down and administer chest compressions? Your patient is choking. They're unable to cough, but they still have a life. They're able to indicate by nodding their head that, hey, I am choking. And so, what are you going to do? What is the Heimlich maneuver? If you chose C, so this one was tricky. A lot of you put A, and we'll go back and talk about that. With the abdominal thrust, previously referred to as the Heimlich maneuver, they are performed while you're behind the person, and you're going to do those upward and inward thrust until the object is expelled. Let's go back and see what A was. So you could have your hands on their chest, but this one specifically said abdominal thrust. So be careful about keywords. Whenever we do chest thrust, that is for someone who we can't get our arms around their abdomen, maybe because they're pregnant, they're obese, or they're wheelchair bound. So for those patients, if they are choking, that's when we do chest thrust. But because this question said abdominal, you could not select an answer option that used the word chest, which is why C was the best choice. Question 40. How should a CNA assist with a patient's toileting needs during the night to ensure safety? A, turn on all lights in the room. B, keep the bed in the highest position. C, ensure the patient wears non-slip footwear. Or D, leave the patient unattended for privacy. And this is so easy. I'm just going to go ahead and show you the answer because we know that we want to ensure safety by making sure the person has on the proper footwear. So the response is C. Oh, we're on our last 10 questions, you all. We are rocking it. Question number 4. What is the first thing a CNA should do if they notice a reddened area on a patient's skin? Is it A, apply lotion to the area, B, reposition the patient to relieve pressure, C, massage the area to increase circulation, or D, leave the area alone and check again in 4 hours? And because we just talked about this, we know the correct response is going to be B, reposition the patient to relieve pressure. Question 42. A CNA notices that there is no urine. A CNA notices that no urine is visible in a catheter bag. What is the first action they should take? A, call the nurse immediately. B, check the tubing for kinks or blockages. C, raise the catheter bag above the bladder to see if the urine will flow. Or D, increase the patient's fluid intake. All right, there's no urine in the bag. What do you want to do? You are part of a team, and everybody got it right. That is right. Do your troubleshooting first. This wasn't a major medical, emergency. Lift the leg, trace the tubing, make sure your patient isn't laying on it. So if no urine is in a catheter bag, it may indicate a kink or blockage in the tubing. Checking or resolving any kinks is a simple and effective way. Um, First step before alerting the nurse if there's still no urine that flows. So always do your troubleshooting first in non-emergency situations, and then you notify the nurse. Question 43. When providing care to a patient with a feeding tube, what should the CNA do to prevent aspiration? Is it A, lay the patient flat during feeding? B, keep the patient in a 90-degree position at all times? C, keep the head of the bed elevated at 45 degrees during the feeding? Or D, lower the bed after the feeding? This one is tricky. And everyone is saying B, except for the endured and Ruth, and it was someone else. Looks like Marjorie. Excuse me. So, everybody, you don't want to keep a patient up at 90 degrees for a prolonged period of time because if you do, you're going to get them a pressure sore. So, whenever someone has a tube feeding, a feeding that's going through their stomach or maybe their nasal gastric tube, you do want them elevated, but not at 90 degrees. They're in a reclining position, they're in a semi-phallus position. So, you want to keep the head of the bed elevated at 45 degrees. There are some doctors say 30. You know not to lay them flat, but don't keep them upright on their butt because if you do, you would be aiding in helping them get a pressure ulcer. So let me read the rationale. Raising the head of the bed to 45 degrees helps lower the risk of aspiration in patients with feeding tubes while avoiding adding pressure to the coccyx area that could increase the likelihood of forming ulcer formation. So I hope that helps you to understand that yes, we want them upright, but we want them upright without causing them to get a pressure sore. Question 44. What should a CNA do if they cannot find the cause of no urine in the catheter bag after checking for kinks and positioning? So you did all your troubleshooting techniques, and Miss Miller still doesn't have any urine coming out of her catheter into her drainage bag. Would you do A, flush the catheter with sterile water? B, notify the nurse for further assessment? C, elevate the bag to increase pressure? Or D, disconnect and reconnect the tubing? Steven, hold on, it went too fast. Hold on, let me find it, let me find it, let me find it. Everybody give Steven applause. Or is it Stephen? Passed the CNA exam, both the clinical skills and the knowledge portion. We are so proud of you. All right, so everybody, for this one, You all, I have not checked emails. I am working in this office by myself this week, so I do apologize. I probably won't. I get 50 emails a day that I have to address, so it has been a rough week. So we'll get to those emails when my secretary returns tomorrow. So, everybody, for question number 44, the correct response is going to be B. Hold up, you all. You all just giving me all this good news. Hey, Don, congratulations. You passed your test today, also. Oh, I got real nurse tears over here because you all are doing big things. I'm so proud of you. So, question 44, let me get back to business. Notify the nurse for further assessment. If basic troubleshooting, like checking for kinks, does not resolve the issue, the CNA should notify the nurse. The nurse can assess and determine if there is a more complex issue, such as a blockage within the catheter itself. Oh my God. I'm just doing my happy dance over here. And Thea passed our CNA exam also. All right. Happy nurse, y'all. Thank you all for giving us updates. And I am so blessed to have you as our viewers and our remote students. Question 45. When removing soiled gloves after patient care, what is the correct technique? A, pull the gloves off by the fingers. B, remove both gloves at the same time. C, remove one glove by pinching the cuff, then use the bare hand to remove the second glove. Or D, reuse the gloves if they appear clean. That was a lot to say. So I'm so happy y'all got the right answer. The correct response is C, because this technique ensures that no contamination occurs when removing gloves. Question number 46. What is the proper way to provide mouth care to a patient with dentures? Is it A, have the patient keep their dentures in while cleaning? If you put a denture brush inside of someone's mouth with their dentures, we're going to report you to the authorities. So it's not A. Is it B, remove the dentures and clean them over a towel lined sink? C, use regular toothpaste to clean dentures? Or D, clean the dentures while they are in the patient's mouth? And everybody said B, thank God. So the correct response is B. Dentures should be removed and cleaned over a towel lined sink to prevent breakage if they drop into the sink area. Question 47. How should a CNA assist a patient with limited mobility to perform a partial bed bath? A, let the patient do the bath without assistance. B, provide soap and water and let the patient manage alone. C, wash the patient's entire body while they rest. Or D, assist the patient by washing the areas they cannot reach. And we're torn. I see B's, I see C's, I see D's. You all, our job as healthcare workers, your job as a future CNA or a patient care tech is to help keep these patients as independent as possible for as long as possible. So as long as they can move an arm, move a leg, if they can move something, it is going to be D. You're going to assist the patient by washing the areas they cannot reach. Do not let somebody who can move just lay in the bed and you do everything for them. CNA should encourage patient independence while assisting with areas they cannot reach, ensuring proper hygiene. Question 48. When should a CNA wear gloves during patient care? A, only when handling sharp objects. B, only when there is visible blood. C, anytime contact with bodily fluids is expected. Or D, only when required by the nurse. When should you put on gloves? Anytime you want to protect yourself. So, what are you protecting yourself from? That is right, Akua and Carlene and Chrissy and Tanae and Grace and Stephen and Thea and Karen. You're protecting yourself from bodily fluids. So, the correct response is C. Gloves should be worn when contact with bodily fluids is anticipated to protect both the patient and the CNA. Question 49. Let me tell you why I'm going fast because I got to be in that car rider's line soon to get my son. So, what should a CNA do if they notice a change in a patient's condition during routine care? All right. Do we want to A, ignore the change and complete the task? B, document the change in a patient's chart? C, report the change to the nurse immediately? Or D, wait to see if the condition improves? Hey, Miss Mary, she's not responding to me. Let me go document it. Wrong answer. It's going to be Miss Mary, she's not responding. Let me see. Let's get that nurse in the room. You're going to report the change to the nurse immediately because reporting changes in a patient's condition ensures prompt evaluation and treatment. And then you can document it. So you have to report it first because in your documentation, you should be documenting the patient's condition and who did you tell about this change in condition. So it's just not that you found them unresponsive. You found them unresponsive. You notified the nurse the vital signs were ABC. That would be complete documentation. Question 50. When assisting a patient with shaving, what is the safest way to prevent nicks and cuts? I have never shaved a patient with a regular razor. We've always used electronic razors in my facilities. So, is it A, shave in the direction of hair growth, B, use long sweeping motions, C, apply alcohol to the skin before shaving, or D, shave against the grain of the hair? I appreciate that. And I don't want to pronounce your name, so I'm saying Okadi from Canada. Welcome. And then the Miller fam, Carlene, Akua, Kelly, the Endurant, Tanae, Yolanda. Everyone chose A. So yes, we're going to shave in the direction of the hair growth because shaving in the direction of the hair growth reduces the risk of nits, cuts, and skin irritation. But the safest thing to do would be to see if the family member could bring in the electric razor so you don't have to shave somebody with a razor. Guess what, team? As I said before, we have all of these free clinical CNA videos on our website. We have a whole playlist in addition to all of the ones that cover the written test or the practice questions. So if you haven't gone to look at our skills videos, go ahead and do so. But you all, I appreciate you all, and I thank you. We have been here for 1 hot hour. We did 50 questions. We had 4 people who told us they passed their CNA exams, and I am absolutely proud of you all. So I'm going to try my best to be back on Sunday or Saturday. So I appreciate you all. I love you, and I will see you in the next video. I have to go pick up my son now, so I won't be able to stay for questions. But you all have a blessed day, and I'll see you later. Bye.